So welcome everyone. We will kind of get started as people kind of log in and join the meeting. I think we will have enough opportunities for us to pause and review the plan outline for the session. So thank you for joining the Empowering Early Career Researchers session. This is part of the networking initiative, essentially in an effort to get us behind the scene. We hear all these amazing talks by our researchers, scientists in different kind of forums and platforms, and always the question in our minds in terms of junior investigators and those who are just starting out is, how do they accomplish so much? What is it that we need to learn from them in terms of how to be successful as a clinician investigator? And this session is focused on that, to be able to dive a little deep into how they planned their program of research and how they've gone about planning their work and their subsequent publication and dissemination. So this session we have planned in this fashion. So the initial introduction, which is a few minutes, we're going to introduce both our speakers and in the initial introduction, and then subsequently we'll have the first speaker, Professor Martha Curley, and our second speaker, Dr. Brian Varisco. And Professor Martha is going to be speaking about building a program of research from scratch. And Dr. Brian Varisco is going to be speaking on the journey from research to publication. And following that, we will have an opportunity to have a moderated discussion. I'm going to encourage all the people joining in to put their questions in the chat so that we can then collate it and present it to the both speakers in a fashion that allows them to kind of cover common themes that are coming up in the questions. And with that, I will kind of move to the introduction for our first speaker. I don't think, Martha, you need any introduction to anybody who's been in the PEDS ICU world unless they've been living in a complete silo. So Dr. Martha Curley, as we all know, she's an endo chair in pediatric nursing at the Children's Hospital of Philadelphia. She's a professor at the University of Pennsylvania School of Nursing. She's a recipient of many awards. One of the ones that stand out is the Claire M. Fagan Distinguished Researcher Award. She is funded by several organizations for her research that is focused on nurse-implemented interventions in critical care. And and she's also the member of the National Academy of Medicine, as well as a fellow in the American Academy of Nursing. Over several decades, her studies have illuminated relationship-based care when partnering with parents of critically ill children, supported the parent presence during invasive procedures and resuscitation, and I think most importantly, informed the practice of caring for critically ill children with acute respiratory failure and many more clinical entities. Dr. Curley has also led the development and dissemination of core metrics in the field of pediatrics. Today, she's going to be talking to us on how to build a program of research from scratch. And maybe I'll reserve the second introduction after Martha is done for Brian, just so that it can flow nicely. Dr. Curley, over to you. I'm going to stop sharing my screen.
All right, I will hopefully share mine. Okay. Okay, how's that?
Perfect.
All right. So thank you so much for that kind introduction. And thank you for the invitation to have this session. And it's interesting because I was a member of the scientific planning committee for this meeting. And then when you contact me to say, hey, would you think about doing this talk? I was like, I don't remember seeing that on the thing, but I'm so glad that you did that, because lots of times things just kind of happen along the way, right? So I have to say that I wasn't as calculating in my building my program of research. It really kind of morphed over time, because as a nurse who was working in a pediatric intensive care unit, and then as a clinical nurse specialist, which is an advanced practice nurse, I just had many questions and wanted to have the data to support what we did. And there were, at the time, over time, we're getting much better at this, but really not a lot of data. So, I then kind of turned my career into building evidence within the subspecialty. But I always get, when you're thinking about building your research career, you have to think about where you want to go with it, and this quote by Stephen Covey is to begin with the end in mind. So you need to be strategic, and you should ask yourself as a junior investigator, what does your ideal career look like in 5 years and in 10 years? Having just said that, I didn't really do that, but in essence, I kind of did. But to have you launch quickly within your research career, you should kind of resonate on the areas that you want to be able to study, and then get yourself tooled up to make that happen. And then really research success is a stepwise endeavor, not all of them forward. Sometimes you go forward and then you go backwards and you have to go forward again, or pivot and look for opportunity. And sometimes as one door closes, a window opens, and then you can find another opportunity. So you have to be well informed about what's going on. And, pick up the journals, take a look at the journals. And I'm glad, that Brian's going to be talking to us about how to land that. But you have to be a student of what's happening, because you're going to look for synergy. Who's publishing what in the field? That's kind of like where you want to go, and be very familiar with where it's going, because you don't want to embark on a huge trial and then find out that the question's already been asked and answered. But have a vision of how you're going to get from here to there in 5 years and in 10 years. So what is a program of research? Different people have different operational definitions. Here's one. It's a coherent expression of a researcher's area of interest. That's important. And it builds from published research literature forward. Relevance, and it captures the passion and the commitment, of the researcher. So when I was introduced, there were different things that I was introduced that I did, but I essentially have a program of research that I've been building over time, and it kind of like falls into nurse-led therapies within pediatric critical care, primarily acute respiratory failure. So how do you measure someone's program of research? And according to Bill, at least 5 database publications in the same topical area where you're either the first or the last author. All right, so you can get on a lot of publications and be in the middle, but it's really, are you leading the program? Are you the person who's doing the work to get it out? So, and think about that, operational definitions. Different levels of inquiry depending upon where you are in the field. So junior investigators, you should be focused, narrow program of research, avoiding jumping around with a series of disjointed studies, because it's, if you really want to be successful, you have to get some depth in some area. You can then move that, mid-career, but you need at least to learn the method deeply within one field. And then as a mid-level investigator, you can broaden that and then perhaps reinvent yourself, which a lot of people do. They may jump into this, in their 30s and 40s to say, gee, I'm just really passionate about research, and how do I retool that? And then senior investigators have programs of research that have more depth in some areas applied to a broader array of patients and patient groups. So these are definitions that come from typically the NIH. Now, going forward, when I was just post my PhD, I went to this very wonderful talk that evidence-based practice was being was being articulated, and Dr. Marshall from the Canadian Clinical Trials Network put this together. This, how do you really develop a program? And so in building a program of research, you want to put it in something that has legs, that will sustain you over time, but you have to be able to ask questions and then figure out what's currently known. So be adept at systematic reviews. We have a really good cadre of research librarians that can help you do that. And then you want to know what's in current practice. And this is a lot of the observational studies, focus groups, or scenario-based questionnaires that you can develop. And then you want to know if it's prevalence, articulate the prevalence of risk factors. So again, by observing, try to really get your operational definitions clear. There's a lot of times that I had to study things and to develop the instruments so that then I could then measure something to go forward. But a lot of people spend their careers, on building instruments. And then you have to think about whether or not a definitive RCT can be undertaken. You might want to do some pilot work to see if you can actually pull it off. And then eventually you land in this, typical advanced, randomized controlled clinical trial. And then you have to get the knowledge out. So once you develop it, you want to be able to not just say, okay, one and done, you then get out. But there are people who just hang out in different pieces of all of this work, and that's completely fine. But in order for you to do a randomized controlled clinical trial, you're building on a lot of other people's work and a lot of other people's thinking, and to advance that forward. And so, the questions are like a kid in a candy store. There's lots of things that we need to ask and answer within the field. And it could be tempting to kind of like go in very many different places. But paying attention to one's practice, knowing what really turns you on when you're taking care of patients and families, knowing that you really want to know exactly one thing, within a field, and then broaden from there. So it makes me nervous when people say to me, I don't have a research question, or, and I'm like, well, geez, you're probably not paying attention to what your patients are and what you're doing within the clinical world, because we have so many questions all the time. But look for any gaps in anything. Individual patients, recurring problems, just, one attending doing something compared to the other attending, and what is the right way. So, thinking about it from that perspective. And then what do we know and what we don't know? And then trying to fill the holes, practice gaps, and, guideline development. And then really we need to also look downstream on patient outcomes and the economic burden of some of the decisions that we make. So it starts with a really good research question, and you aligning to that question, and then designing a process for you to answer the question. It's important to use data if they are there. Secondary analysis of existing data are huge. For example, within the Restore clinical trial, that was a huge clinical trial, 30 sites participated, but we were, based on that database, able to answer and publish another 20 papers that answered different questions related to that. So always look for secondary analysis if you've got data that you can pull, or think about primary data collection, or maybe a little bit of both. And then know that you're not alone in this process. Research, clinical research specifically, is a team sport. Look for a cadre of people who are interested in the same thing, and then work synergistically. And definitely consult with your statistician early, and then definitely make best friends with human subject people, because it's always a work in motion, and you want to develop a nice relationship with someone who's very talented from a human subjects perspective. I loved a lot of conversations that I used to have when I was in Boston with Joanna around human subjects. So please think about that. When you start pulling forward, and this is just a list of all the different reasons why people don't get the funding that they need and they don't move forward. It might be because of the idea in itself, whether or not you have an acceptable scientific rationale for the study, the scientific premise of the study, and then your study layering on top of existing knowledge is huge. So you can't ask a question before it's time. So another reason why it gets dinged. Lack of knowledge of published relevant work. It's important for you to know what's out there and what people are doing, because you're paying it forward. Uncertainty concerning future directions of your work. may be dinged, or just really a diffuse, superficial, or unfocused research plan, lack of experimental detail, lack of experience in essential methodology is huge. So you need to be mentored along the way, and grant reviewers will look for what makes you experienced in that methodology. And if you're not experienced, who is on your grant, key personnel to help you do that. And then a lot of digging around questionable reasoning and experimental approach, uncritical approach, and unrealistically huge amount of study within one data. And here are, this is a nice graph to when